Hello, my name is Blessing Tia. I'm a second year pre-nursing student, and this summer I conducted research to understand how the current healthcare system disproportionately affects Black women in the United States. And I discovered more ways in which Mount St. Mary's University, along with future healthcare providers, can help collaborate to break the cycle.
Welcome to the CSJ Institute. I'm so glad that you're here to explore more of our history and see everything that the Institute has to offer.
Another important virtue that future healthcare employees, especially those who are Mountain graduates, need to keep in mind is the motto and charism of the CSJ sisters. To serve their neighbor without distinction means to serve and help others and not just do it for the money or the title. It means to do it with the intention of addressing the injustices that we encounter in the world, and to do this for each and every member of our society, not just people of a certain socio-economic status or race/ethnicity. I was able to meet with Dr. Krishana Hines Gaither.
Dr. Hines Gaither suggests that hiring is the most effective in creating a workforce concerned with respecting the dignity of a human. If we hire people who are more ethical friendly instead of the opposite, we should be moving forward to create a more inclusive and diversity friendly healthcare system with equal benefits for people of all backgrounds, including ethnicity, race, and sexual orientation. Another important factor that we could use in the hiring process is hiring more Black medical providers to create a space where Black women are treated by other Black professionals in which their needs are being met by someone who shares the same experiences as them, so that their voices are being heard. During this summer research, I was also able to meet with Dr. Marcia Nickerson, and she helped present this idea of Roy's adaptation model. Current nursing students follow the framework of Sister Callista Roy. She was a nursing student at Mount St. Mary's University who graduated in 1963 with a Bachelor's of Science in Nursing. She then furthered her education and earned a master's degree in pediatric nursing from UCLA. And she's also a sister of St. Joseph of Caron de Lec. Then she earned her master's in sociology and completed a doctorate degree in 1977 in sociology. She created her own framework called the adoption model of nursing. And in this model or framework, she asked 3 questions. Who is the focus of nursing care? Who is the target care of nursing? And when nursing care is indicated. These were questions designed in order for current and future nurses to access their patients in a more holistic approach, meaning seeing the patient as a whole human being and not just evaluating them as an illness or disease. And under this concept of physiological self-concept, role function, and interdependence. According to this model, Roy believes that the goal of nursing is to promote adaptation of the patient during illness and health using the 4 concepts of her model. She believes in the assessment of the patient as a whole human being and not just assessing them as a number or a disease. If future nurses and current nurses follow Roy's adaptive model of nursing, we can all be sure that our patients will have the highest quality of care and that that individual patient will be secured in their situation. And having critical consciousness can also be an important factor in this. And for those of you guys who don't know what critical consciousness may be, it's described as the focus of having an in-depth understanding of the world that allows for perception and exposure of social and political contradictions. And critical consciousness means to be fully aware, or you can't always be fully aware, but you can try to be fully aware of our world and what goes on in it from different sides, regardless of where you may stand with an issue or movement. In Paulo Freire's book, Pedagogy of the Oppressed, he describes critical consciousness as the ability to recognize oppressive social forces shaping society to take action against them, which is very similar to the idea of a praxis that Bell Hooks discussed in her writing. A praxis is a move towards change. If we are more aware and have critical consciousness, we will be able to see and help change the effect of white supremacy in our nation. And this is possible because the more socially aware we are in this issue that causes harm to Black and African Americans, that we can help break the cycle and we can help promote a better change. Critical consciousness can help break through white supremacy in healthcare and help us as people, students, and future healthcare providers gain the ability to recognize and analyze systems of inequality. And it helps us commit to take action against the system of white supremacy. And this is a perfect way for us to create a praxis towards change, to break this cycle that has been prevalent for so many years. Just because these cycles of health inequalities have been existent for centuries doesn't mean that we can't be better and try to break this vicious cycle. For example, future healthcare providers can help educate themselves in order to eliminate some bias that they may have. Although sometimes as humans, we can't always recognize that we may have bias or get rid of certain biases that we may have had unconsciously, but we can try and make an effort to not assume or give into any negative stereotypes about certain groups of people based on sexual orientation, race, and religion. Implicit bias is a form of bias that occurs automatically and unintentionally that affects judgment, decisions, and behaviors. Previous research has shown that this implicit bias can be a barrier to recruiting a diverse and workforce environment. One of the ways where future employers can see where their potential employees' headspace is regarding biases can be used taking an implicit association test. And what an implicit association test is, it's a test that measures the strength of associations between concepts. So let's say like flowers, insects, they basically evaluate what type of unknown biases that you may have. So it's used to test implicit biases that lie beyond our own consciousness. And this is a really good tool to use to identify how potential employees may feel about certain groups to see if they have any implicit biases that may need to be addressed or recognized before they get into the healthcare system.
We need to use our knowledge in a transformative way, meaning a way to educate others who are not aware of certain issues, and to help expand other people's imagination. This can be done by challenging other people or other employees who fail to represent and serve everyone fairly.
Okay, so here's some more statistics about racial health disparities. More recently, in a 2019 study, it was shown that Black women face higher risk of pregnancy. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white people in the United States. And the blame for racial differences in income, wealth, education, employment, and health rests firmly upon the system of racism that was established even before the birth of this nation, America. And this was also inherent in the COVID-19 pandemic. The COVID-19 pandemic is a great example of how systemic racism contributes to the inequalities between Black and white Americans. And in July of 2020, hospitalization and death rates per 10,000 people were much higher for Black Americans. The rate was 24.6%, and then the rate was 5.6% for deaths. And then for white Americans, the hospitalization was 7.4%, and the deaths were 2.3%. So we can see that that was a huge gap compared to Black and white Americans and the deaths and hospitalizations. These statistics show that white Americans have benefited more from the healthcare system than Black Americans have. And as a future healthcare provider, especially, it is essential to continue to be knowledgeable about these statistics and findings because it can help us work on fighting systemic racism that has been present. And now I will go over more disadvantages for a Black woman in the healthcare system. So according to an article titled "The Health Status of Black Women, Breaking Through the Glass Ceiling," this was made in 2007, but I still wanted to use it because I found that it was pretty relevant even to today. So that's why I'm using it. And it was shown that Black women suffered disproportionately from poor health compared to their white counterparts. And the history of Black women's access to healthcare in the United States has contributed to this, especially in the field of gynecology, which is the contributor to health disadvantages that Black women deal with. There has been high levels of morbidity and mortality in the Black population, especially with Black women, because according to a more recent study, it states that Black women tend to lose less weight than other populations, which can lead to obesity. And even though it was proven that Black women have a higher body self-image, it may give in to Black women not wanting to lose the weight and be healthy in the way that they're supposed to sometimes, even though body positivity is a good thing. In the same 2021 study, it was also proven that Black women earn less. They earn less than $5,500 per year, and they experience higher unemployment rates compared to US average for women. So they experience more poverty than white Americans and Hispanic Americans. Black women are also more likely to be the head of their households than their white counterparts, and they are more easily to be more of a dependent. This issue has to do with underlying racism and white supremacy that has been involved in the healthcare system. Especially those of us that plan to become future healthcare providers, we need to be aware of these things. Obesity rates are significantly higher in Black women than it is compared to white women. This is a piece of information from the 2007 article, but like I said, I still found most of it relevant. And a lot of this has to do with the fact that high-calorie foods are more marketed on Black television, and fast food restaurants are more prevalent in low-income neighborhoods. Like as we pass by South LA, I don't know if you guys have noticed, but I've noticed that there's been more fast food restaurants in South LA than compared to when we go to West LA. There's more healthier options for people who are of higher socioeconomic status. Like the options that there is in South LA, there's McDonald's, Burger King, Food for Less, when most of those stores don't really serve the healthiest options. But if we go to the West Side, we see that these organic local grocery stores are more prevalent in that type of neighborhood. The California's Black Women's Health Project is a statewide nonprofit organization that's committed to improving the health of California's 1.2 million Black women and girls through advocacy, education, outreach, and policy. And they mostly focus on empowering Black women to take responsibility for their own health and to advocate for changes in policies that negatively affect Black women's health status. The last one that I will represent is Sisters Network Incorporated, and this is a national African American breast cancer survivorship organization. And their goal is to lower the mortality rate of breast cancer among Black women. They do this through increasing national attention, providing information and resources, and aiding research offers. That is the end of my presentation, and I hope you guys learned a lot from what I had to present. Thank you so much for your time.